This is Africa News Tonight on the Voice of America.
The World Health Organization is holding its Africa regional meeting this week in Brazzaville, Republic of Congo. Reporter Eric Kawa is there, and he caught up with Sierra Leone's Minister of Health, Austin Demby. Here's an excerpt.
Well, malaria is the number one killer in Sierra Leone, and I think for us, we're doing everything in our power to turn this around. We have a multi-step strategy. First, we've introduced a new malaria vaccine, and we have over 1.5 million doses of the vaccine that we're administering. At the same time, for a population of about 8 million people, we have about 5 million insecticide-treated nets that we're distributing throughout the country. We're also looking at diagnostic capability with rapid tests and smear microscopy. We're looking at insecticide indoor residual spraying that will reduce the number of vectors that are available. And I think a combination of these we think will make a major change in the health outcomes around malaria. Will reduce the infection rate and will reduce the mortality associated with it. So all of these things have been in play with this rainy season. And I think as we're coming to the end of the rainy season, we'll have a quick evaluation to see what the delta was, what the change was before and after our interventions.
Let me divert your attention a bit to another health-related issue that has to do with the mpox, which is now prevalent. There were some suspected cases in Sierra Leone, but there were certain clinical trials, and that seemed to be negative. But then how prepared is Sierra Leone's Ministry of Health, or what are the strategies that have been put in place to probably be in better alert?
Well, I think Sierra Leone is perhaps in the most prepared state than we've ever been. I think coming back from an Ebola experience, you saw how we dealt with COVID. I mean, there's a lot of internal experience around managing epidemics. And I think for us, we're very, very grateful that we have an institutional home that harnesses prevention, preparedness, and response. We have a new National Public Health Agency. The new National Public Health Agency, it's dedicated to preventing these kinds of outbreaks, but at the same time, preparing for them, and at the same time being able to respond very, very quickly to these outbreaks. So what we've also had is what we call field epidemiologists. We have over 450 trained field epidemiologists who are embedded in our primary healthcare system. They look to see the support the primary healthcare system, they support the local PHUs and DHMTs, the district health medical teams, to look at their data on a regular basis. And when they see anything unusual, they alert the National Public Health Agency, and a rapid response team is deployed to be able to help the local teams manage the situation. So that's what we see, with mpox. The country is ready, and what we've done is alerted all of the district health medical teams, and everybody's on the lookout. We've had clinical signs and symptoms of what to expect, and we have instructions on how to manage this. So what you see now is very active surveillance that's going on, not only in the border areas, but throughout the country. And if you see anybody with fever and pain and rash, what you do is you alert the health system, and a team will go out there and rush in there and see if it's mpox. Will contain the person, will treat the patient, will manage the patient, will break potential for transmission.
That was Austin Demby, Sierra Leone's health minister. He was speaking with reporter Eric Kawa at the WHO Africa regional meeting in Brazzaville.